Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics. I love showing off cases that have some unique things going on, especially when it's a phase 1 treatment. So phase 1 is kind of our early treatment when we're working on 7, 8, 9, 10-year-olds. And a lot of times I get people that are coming up to me and they're like, hey, this is crazy. Like, I've got my friend's kids are 8 years old and they have braces on. Like, what's going on? And it seems like all these kids in elementary school are getting braces now. What's the story with that? And look, let me be clear. Most kids are not going to require early phase 1 treatment, but there are indications for phase 1 treatment, and we talk about those all the time. One of them is severe crowding, and when we're trying to prevent the extraction of adult teeth in the future. So that's one reason. The second reason is some things that affect the growth of the jaws, like occasionally underbites and things like that can affect how the jaws are actually growing. We might also enter into phase 1 treatment because teeth are erupting in some weird places. Maybe they're erupting where they shouldn't be, or they're erupting and they're gonna disrupt the normal pattern of eruption. So those are the most common things, but occasionally you get things that are less common, and this is one that is less common. So this is Camille, and Camille came to us with the chief complaint that she was biting into the roof of her mouth and that it was actually painful for her. And it's a little hard to see, but when we take a close-up at her teeth, you can see that her lower teeth are biting right into the roof of her mouth. They're biting kind of into the gums behind the upper front teeth. And part of the reason why this is occurring is because of how much these upper front teeth are overlapping vertically the lower front teeth. You can't see very much of the lower front teeth except by looking through the gaps and seeing them. And most kids who have this, we call it a deep impinging bite. So the bite is impinging on the roof of the mouth. Most kids who have deep impinging bites do not complain about it. They're not usually painful, but deep impinging bites can cause gum recession on the backside of upper front teeth. You definitely should not have gum recession before the age of 10 or really ever. And so that's one reason why we got involved here. And it certainly shouldn't be painful. So we did a quick little treatment with braces. We call it a 2x4. So 4 braces in the front of the mouth. Actually, I put 6 on. I put them on the 2 baby teeth next door. So 6 braces in the front of the mouth, 2 in the back. And we closed up spaces. We tried to get less overlap of the teeth. And so this is where we ended. You can certainly see more of the lower teeth now. We've got nicely aligned teeth, so Camille likes her smile more, which is an added benefit. That's not why we were in there, but it's a nice added benefit. And then, we are going to give her a retainer, and that retainer is going to protect the roof of her mouth. So we've gotten her out of pain just alone with the treatment that we did, but the retainer is really going to maintain that and make sure that her bite doesn't return to the state that it was in, make sure that she doesn't continue to bite into the roof of her mouth, and to make sure that it's not painful for her. So anyway, cool little treatment here, and we got one happy camper when we're all done. So what a change in her smile. Love this little girl, just a really sweet girl, and really happy to do this treatment where we were really in there to get her comfortable, but also in there to make sure that the bite is healthier and she gets a nicer smile as an added result. So anyway, great job, Camille. We love you, and this is a great phase 1 treatment. So thanks for being an awesome patient for us.